All right. Well, welcome everybody to our very new podcast called Advocacy at Work, where we are exploring how different organizations use advocates to help drive their mission, which could include growth, fundraising, and other avenues of impact for their organizations. And I am so thrilled today to have Amy Niles, who is the Chief Mission Officer for PAN Foundation. And I will just preface by saying that I am a member of the Patient and Family Advisory Council for PAN Foundation. So I do have some knowledge and have met Amy in person. So Amy, welcome, and just tell us a little bit about you before we get started here.
Well, thanks, Tim, and I'm so honored that you invited me to do this. And we are thrilled, absolutely thrilled, that you are a member of PAN's Patient and Family Advisory Council. As you said, I'm Chief Mission Officer with the PAN Foundation. I've been with PAN for now 11 years. Seems like some days it seems like 2 years, some days it feels like 20 years, depending on what's going on. But I love the work because I love our mission, which is all about, making sure that people can afford and access the care. I've been in the work relating to access, for around 20 years. Prior to PAN, I was with another organization that had a similar focus. But my background is a bit varied, lots of turns, as often is the case. But at the core, I've always been in the nonprofit health world and helping patients. So I got my start in hospital administration. Love that work. I was president and CEO of a national women's health organization, and now I'm doing the access work. So all about really ensuring that people get the best care that they need.
Well, it's so important as a patient myself, and I know that. So, just thank you for all the work that you do right off the bat. So before we get too far into the questions, at how would you define advocacy when it comes to, specifically in this case, patient advocates?
Yeah, it's an interesting question because I think, depending on who you ask, you might get different responses. And when I think of advocacy, I think of kind of two things, which are both really important. First is being your own best advocate, right? Or being an advocate to support someone you love or a friend who may be having challenges, and encouraging individuals to seek the best care, to have conversations with healthcare providers. So it's that personal advocacy that is really important. Mm-hmm. And we embed that in the work that we do at the PAN Foundation. But the other definition, which is a lot of my focus here at PAN, is the advocacy work to drive policy solutions that are going to be the most impactful for patients in terms of improving access to care. And so we do a lot of that kind of advocacy policy work at the federal level right now for the PAN Foundation. Both are really important, right? It's the latter, the policy work, is you have to have a long view of that, right? Because policy doesn't change overnight. Legislation doesn't get passed overnight. But we've had some successes, which I can talk about at PAN. And if you're so fortunate to have those successes, you're not just helping, a patient one at a time. You're now in a situation where you can potentially help millions of people improve their care. And that's really impactful and meaningful.
Oh, very, very much. And I all too well know, as you can tell by my background here, that I have been up to DC for several years now, and I keep asking the same thing, telling the same stories, and haven't seen anything change yet, but it's not stopping me from keep doing it.
We all have to continue doing that work, because at some point in time, that work will culminate in a piece of legislation that's going to make a difference.
Yes. Well, I know it was before I started getting involved in this work that, as a colorectal cancer survivor, that the age for screening got dropped from 50 to 45, and then subsequently the mandatory coverage of insurance if you tested positive for a non-invasive screening test to get your colonoscopy covered if you tested positive for one of those was required by insurances, which took away the cost of the patient having to have that financial burden. So I know those were two major issues that had a huge impact in the colorectal cancer space that I heard took like 10 years to get enacted by multiple organizations all working together. So
well, it's funny you say 10 years because and we can talk about how advocacy kind of started at the PAN Foundation, but one of the areas that we've been really active in at PAN has been Medicare reforms and changing the Part D design for people on Medicare, which, you know, includes people over 65, but also people on disability. And we have long advocated for lowering out-of-pocket caps for people on Medicare, because prior, you know, people had no limits. People could spend $5,000, $10,000, $15,000 or even more in out-of-pocket costs. So we were advocating for many, many years, and 10 rings a bell because that's kind of when advocacy started at PAN, advocating alongside many other organizations, alongside individual advocates, and ultimately when the Inflation Reduction Act got passed in August of 2022, some of those key Medicare reforms were included. So you really do have to have a long view of advocacy and be patient. It takes time. It takes telling that story over and over again, but it's important that we do.
Yes. So let's get into like a little bit more about, you know, what PAN Foundation does and how advocates help you in that mission.
So we are a national charitable foundation, healthcare advocacy organization. Our mission is all about access to care, making sure that individuals have access to affordable and equitable healthcare. And how do we do that? We describe it at PAN as through what we call our 3 pillars. The first is financial assistance. So we, through 80 plus different programs, we are able to provide grants to individuals who meet our eligibility criteria, which over a 12-month period helps cover out-of-pocket costs for prescription medications, copays, deductibles, cost sharing. And these 80 programs span oncology, it spans other chronic diseases, rare diseases. And it's so meaningful because we know medications can be expensive, out-of-pocket costs are high, and if we can eliminate their worry about affording their medications, hopefully we can give them a little breathing room to really focus on what matters the most, and that's taking care of themselves. So we're humbled to do this work. I always say, gosh, I wish we didn't have to do this work, but we do. And over the 20 years or so that we've been around, we got our start in 2004. We've helped more than 1.3 million people access the care they need, providing more than $4.5 billion in financial assistance. So big numbers, and yet we know we're still probably just scratching the surface of the people who need our help. And many of those individuals are people on Medicare because we know they can't go to a pharmaceutical company to get assistance by law. So we become a really important safety net. So that's our first pillar. The second pillar is all the advocacy work. And we can talk more about that, but it's all about advocating for those patient-centric policy solutions that will improve access to care. And then the third pillar is education, where we deliver education to both patients and healthcare providers about often really complicated subjects. It could be Medicare reforms, it could be how to navigate your healthcare plan, and so forth. So you asked why advocates are so important to us. It goes back to what you said. You're up on the Hill all the time sharing your story. And that's what it often comes down to. I always say, it's one thing for me on behalf of the Pan Foundation to walk into a member's office and to speak with staff about, you know, a policy that's just not working for patients, right? But it's a whole nother thing, Tim, when you go into an office and say, here's what I'm experiencing with step therapy or whatever the issue might be, and this is how it's impacting me in a negative way. And this is why we need such and such bill passed, because it's going to improve access to care for millions. So those lived experiences are so important for policymakers to hear. It resonates with them.
Yeah. So a lot of, as I look at it with advocacy, yours is mostly in the legislative field, advocating for legislative issues that are on a federal level.
Yeah, we monitor both the legislative environment and also the regulatory environment, because there may be things in the regulatory environment that we have to pay attention to, but most of our time is at the federal level. The state work is interesting because I think it's growing in importance. I think we're seeing in absence of legislation being passed at the federal level, states are doing more. And so it's something that we want to think about. But most of our work to date has been at the federal level.
Well, and it's even, I think, getting more light in today's world right now with what's happening with the budget that's making its way through Congress right now, and specifically with Medicaid, and how they're looking at transferring that to the state level instead of at the federal level, which certain states will help and certain states won't. So it's like a lot of these issues might become more specific states and in addition to federal.
That's exactly right. And the example that you just gave, speaking about Medicaid and what's happening with the reconciliation bill and so forth, is really a great example of how we are engaging advocates on this issue, because we at PAN are concerned, right? We're all about access to care. So when Medicaid gets cut, well, that's going to potentially impact millions of people and their access to care. When research gets cut, well, that can impact clinical trials, and those clinical trials no longer exist, and that impacts patients. When agencies get abolished or staffing gets cut and someone on Medicare needs to call an agency to get an answer to a question and there's no one there to pick up that phone, that impacts. So when we saw this, we thought about, well, how do we, not PAN per se, but how do we engage advocates? And so we've actually had a grassroots campaign going on now for a couple of months. It's called Healthcare is at Risk. And we've asked advocates, individuals across the country, to send messages. It's through our advocacy platform that we have at PAN. Send messages to your members of Congress and just share your stories, express concerns. We don't tell them what to say. And what's interesting is that we've had over 6 weeks or so, we've had nearly 10,000 messages. It's an amazing number, 10,000 messages sent to members of Congress. And what's really interesting is that about 50% of those individuals took time to personalize a message and to share their story, which says a lot. People are concerned. And so we're grateful that we are able to give advocates a platform to do that, because I think oftentimes advocates, individuals don't know, like, how can I help? And is it really going to make a difference? Like, it's easy sometimes to just not do anything, but we make it easy for someone to know, I can make a difference. I can share my story.
Yeah, I think that was part of when I was first diagnosed with cancer. It was like the one thing that it took me a couple of days to process everything, but then I knew that it meant that I was supposed to get out there and make sure that I advocated not only for myself, but also so other people that didn't have to go what I was going through, or didn't have to face the same issues that I was facing in their journeys. And I just kind of lucked out, I think, by getting involved in a couple groups that pointed me in the right direction, and then had friends and family that were giving me other resources, and it just kind of took off from there. And I'm 4.5 years into it right now, and I'm still learning new things, and I'm learning about new organizations out
and
there.
you'll continue that.
It's like it's never going to stop.
Exactly. Well, I mean, we learn as well. So I think you really, Tim, are a model advocate in so many ways. So have to thank you for all that you do. It's very meaningful work.
Yeah. So when we look at PAN and advocacy in particular, were advocates always part of PAN from the very beginning, or when did they come into play, and how has it evolved over the years?
It's a great question. And the answer is advocates have not been involved since our inception. So we go back to 2004. And I'd say for the first 10 years, PAN was really solely focused on providing financial assistance. That's how we started. And obviously we continue to do that. I came to PAN in early 2014, and my title at that time was something like Director of Alliance Development. My role was to connect with external organizations, to form partnerships, see if we can work together, which I still do to this day. But when I came on board and realized how large a foundation we were and how many people we touched every year, I started thinking, why aren't we doing more? Like, the financial assistance is so important, so important. We're changing lives, but we have these individuals, hundreds of thousands of people that we could leverage and support our advocacy work. So my first task was to talk to our CEO at that time. He was on board. He said, okay, I think this is a good expansion of the PAN Foundation mission. My next task was to go to our board of directors and say, we should do this. That was an interesting process. It wasn't like a switch, that I turned on and they said, oh yeah. We had some who was engaged in advocacy work and they understood the value. And we had some board members at that time, and we're a completely new board today, but we had some board members who said, waste of time, waste of resources. You're not going to change anything. Why bother? At the end of the day, through a lot of education, the board came around and said, okay, go at it. So it was really up to me to kind of build the advocacy work. And I will tell you, over the 10 years, really every year has been tremendous growth for us, which is exactly what we want to see. But we began small. We began with creating what we called position statements. So you can't advocate, as you know, for everything, right? You have to pick those topics that are going to resonate most with patients and align with your mission. And so we created a number of those positions, and mostly what we did in the early years, we were focusing on those Medicare reforms that were so needed, lowering out-of-pocket costs. So we have those position statements, and they're board approved. And to this day, we review them every year. We create new position statements and so forth. Then we said, okay, let's create some issue briefs. So we spent a lot of time writing very lengthy reports around particular topics that had great content in them, but honestly, I don't think anyone read them. So we kind of abandoned them after a while. Then we decided, we need to get more serious. No other charitable foundation really was doing this advocacy work. And so we engaged a government relations firm, got them on retainer to kind of help us frame out what we should focus on and how we would do that work. And from that evolved, the topic areas that we were interested in, the specific pieces of legislation we should advocate for. And we started, meeting with offices on the Hill, introducing them to PAN, because, regardless of the legislation, we felt, the members have their own constituents who may be struggling with financial resources. They should know about PAN. We started signing on to letters, leading letters. And so we did that for a number of years. All of that was great. And then we thought we need to engage advocates more in this process. And so we did two things. One is 3 years ago, we started our Hill Day. You were part of that for both years, or last year?
Last year, yep.
Last year. And, we now call it our Advocacy Action Summit. We started really small the first year. Our first year, we brought 40 individuals to DC. Our second year, which is last year when you participated, we had 65. And now this coming September, we're bringing 85 individuals to DC. And I don't know about you, but I mean, that is our sole event at PAN. And I look forward to it because it's so impactful. And when you're in a room with 85 Tim McDonald's who are telling their own story and are so passionate, it's quite moving. And so we'll continue to do that every year, and we intend to grow every year. The second thing that we did was create the platform for these grassroots campaigns, because we can't bring everyone that we want to Washington, D.C., right? We have a limited budget. So we do the best we can, but we can engage people across the country. Doesn't matter where you live, right? You can pick up the phone from wherever and call your member of Congress, or you can use our platform and easily send a message to members of Congress. So over the last several years, we've had various grassroots campaigns that really align with their legislative priorities that, include, step therapy, include prior authorization, things like copay accumulators, which impact people with commercial insurance, and so forth. And so now we continue to do all of that. Now we're at a point where we really want to go one step further, and we're creating what we're calling our ambassador program. So, our PFAC members, we consider already to be our ambassadors, but we want to formalize it a little bit more. And over time, we want to have ambassadors, people on the ground in every single state who are helping us with our advocacy work. So it's interesting when you ask me that, because when I look back 10 years, I think, wow, we have, our advocacy program has really grown, and I'm proud of that. But I'm most proud of all the advocates we have engaged, from our PFAC, Patient and Family Advisory Council members, to everyone who is online engaging at the grassroots level.
So I have kind of two questions that I'll combine into one, and then we'll move on to a quick little fun lightning round where I just need like a little quick responses from you, and then we'll wrap up.
Okay.
I'm always curious, like, how you go about finding these advocates, and then also how do you measure the impact that your advocates are having?
So finding advocates, we do that in a number of ways. I think when we first started thinking about grassroots campaigns, thinking about our Patient Family Advisory Council, we thought we should start with the patients we've served at PAN, right? They are hundreds of thousands of patients dealing with cancer and other chronic diseases and rare diseases. And gosh, some of them should want to engage in advocacy. So we went out to our own patient population, and that's how we formed the Patient and Family Advisory Council. A lot of it is organic growth. So members of the Patient and Family Advisory Council know of other individuals and have helped bring them along. We might meet someone who's speaking at a conference who is wonderful, and we'll engage them that way. We find people perhaps through our social media platforms. We have lots of individuals who share their stories through our our website. And we know many of them are already advocates or would like to advocate with PAN. So no set formula. It kind of organically grows by itself. Measuring impact is an interesting question, because I think when I go back to our board in the early days, when I was trying to convince them, that would be what they would say, like, how are you going to measure impact? And it's very, very hard. I think for us, it can mean different things. It can mean the number of patient voices we are gathering to help push for a piece of legislation. So that engagement, right? I mean, ultimately, the impact of advocacy is passing a piece of legislation, right? And so that's hard. That does, as I said, that doesn't happen every day, but we were successful with the Medicare reforms. Those reforms didn't pass because of PAN, but we participated in many conversations. We got the advocates engaged. And so we take that as a success. And so I think, the impact ultimately is our ability to push for the policy solutions that we need to improve access to care.
Well, great. All right. So I got 4 questions.
I'm scared now.
Just whip off the answers as soon as they pop into your head. I don't need big, long explanations, just whatever it is. So we'll start with the easier ones and work up to a little bit more difficult. But none of them are too difficult, I hope. But what is your favorite color?
Black. Isn't that a terrible response?
No, but I think you're the first person I've ever had give me that answer.
Black goes with everything.
What is your favorite band or musician?
Ooh. Can I give you 2?
Yeah.
They're not real current, but growing up, loved Elton John. He was my favorite, and Eric Clapton.
Perfect.
I'm a rocker at heart. I like rock. Not hard rock, but the traditional rock and roll bands.
Yeah. And what's a place that you've always wanted to visit but haven't yet?
Greece.
Nice. And
it's funny, I was just thinking about Greece last night. It's funny you asked that.
And we're planning a trip to Europe, and we were deciding between Italy and Greece, and we ended up with Italy.
That's your next trip.
And lastly, what is one thing that most people do not know about you?
I swim a mile to a mile and a half every morning at 6:30 in the morning. And it is my way of starting my day in a most positive way. I've always been a swimmer. So for me, swimming is not only good physical exercise, but it helps me mentally. And also, I get some of my best ideas swimming back and forth in the pool.
Nice. I got a whole nother story I'll tell you about when I asked that question up in Denmark, and I learned that they swim outdoors in the wintertime.
Funny.
So to wrap up here, and I just really want to thank you again, but this is just a big question. So what is one, just huge thing, big thing, if you had unlimited resources and that was not an issue, that you would like to do with your advocacy program?
So I think it goes back to something we talked about, and it's state policy. So state policy, for the reasons we talked about, is really important. It's growing in importance, but every state is different, right? The easy part of federal legislation that it impacts everyone regardless of where they live, but every state is different. And it's, as we think about, should PAN engage with state policy, it's very resource intensive. Now you need to have people on the ground in every single state advancing that work. So if resources were not an issue, that's what I would do. I would have people on the ground in every single state helping to advance the work of PAN.
Fantastic. Well, Amy, thank you so much for joining me today on Advocacy at Work. And I can't wait to get this published and share it with more people. And I really want to say that, you know, the work that you guys do is so impactful for so many patients, including myself, that I tell everybody that I can about what you guys are up to and how you help patients with chronic diseases, because it really is something that most people, you know, when you're going through something like this, don't have the energy to actually go through the research and the investigation of what's out there. And so I view it as, I got a little bit more energy now. I can do that work and help share it with people so they don't have to. So just thank you for everything that you guys do.
Well, thank you for the work that you do. Truly, I get my motivation from individuals like you. So I appreciate all that you do and really appreciate the opportunity to have this conversation with you, and look forward to having even more in the future.